My name is Qinglin Yang, or most people call me as Q Yang, Q, so make it easy to remember. And so my study pretty much focused on understanding the molecular mechanism, how the heart supply energy and utilize those understanding of the mechanism for clinical treatment study. So in the last couple of years, we come across with an animal model that pretty much like knocking out a key enzyme involved in the long-chain fatty acid metabolism, which is the main source of energy to supply the heart. So why we understand that, we try to study that because there are many studies in the past decades have found that inhibiting fatty acid oxidation may actually be beneficial for the heart, especially for those patients who have suffered heart failure. And there are some early clinical trial and there's some clinical utilization in some country, like in Europe and Canada, and some of the fatty acid oxidation inhibitors have been used to treating patients with cardiac disorder. And also there's many proposals to propose the use of these inhibitors to treat heart failure patients. And the basic mechanism is that when we inhibiting fatty acid oxidation in the heart, we could facilitate the utilize of glucose. Instead of using fatty acid, to use glucose to supply energy. And with that switch actually could more efficiently utilize the limited oxygen that supply the heart under pathological condition. So to test that, there are many ways to do that. Mostly people using directly test those compounds that inhibiting fatty acid oxidation. And the last couple of years, we come across with the animal model that with a specific deficiency of one of the key enzymes regulating the uptake of fatty acid, long-chain fatty acid into the mitochondria. So this is the enzyme, we call it CPT1. So now we come across with this animal model, it actually genetically manipulated, so the CPT1b, one of the isoform of this enzyme, was knocked out. And of course, we cannot get the animal with complete knockout because that's so essential. This enzyme is so essential that's basically killed the mice during the embryonic stage. And so we could only use the heterozygous mice. It means that there's still one allele of the CPT1 enzyme, CPT1b enzyme in the mice. So we use this animal model and then subject this animal to a procedure. We call it aortic transverse aortic constriction. So we could basically narrowing the aorta to create a situation like those patients who suffer hypertension. So because you have those patients have hypertension, so the pressure inside the left ventricular or inside the heart actually is increased, and that ultimately cause hypertrophy or the enlarged heart and then heart failure. So since we have this model, we try to test that and see whether this actually is helpful for the heart. So to our surprise, actually, we found this is bad. Actually, when we try our first set of experiment, we using a condition normally we use. It means we create the pressure overload condition, and most of the animal died prematurely. So we have to reduce the pressure overload condition. And then in the second set of experiment, we finally could assess what's going on. And then we found the main striking finding is that those inside those heart, actually, we found a whole lot more lipid accumulated. And one of the key lipid species is the ceramide. So ceramide, long-chain, especially long-chain ceramides are accumulated in the heart. And that have been well known that the long-chain ceramide could kill cardiomyocyte, or we call it apoptosis. So now we understand that inhibiting CPT1b may cause this kind of problem. So that's why we think this study is important to enable us to understand the mechanism, and also to make sure we be more cautious when we're testing this kind of drug. And the the degree of the inhibition and the duration of the inhibition may be very important.